Today, inshallah, we're going to start a new topic called telemedicine, and a very special topic from telemedicine, which is teleradiology, basically, as an application of telemedicine. We're going to start with basically a basic definition of telemedicine, which is basically the delivery of healthcare using telecommunications, computer, and information technologies. So basically, it's not just a matter of being remote. It's not just remote. Remote is definitely a part of the definition, but actually you have to use telecommunications, computer, and information technology. So basically you have to use the three of these things. So basically, if you're talking about consultation by means of a telephone conversation, for example, alone, this would not be qualified as a telemedicine, based on this definition. Because basically you don't have the telecommunication. You have telecommunication because you have a phone, but you don't have a computer or information technology used in that particular application. So basically, you have to have healthcare delivery using telecommunication, computer, and information technology. All three must be involved in order for the application to be termed telemedicine. In general, we have two models in telemedicine. The first one is basically a referring physician can consult with a specialist at various locations through the network. Basically, you're talking about individuals talking to each other. So basically, a particular physician would consult with a specialist he knows. And basically, we're talking here about very specific persons. On the other hand, the referring physician can request opinions from a consolidated expert center. This is a new thing here we're going to talk about, which is a more dominant model. We're talking about, for example, if you're talking about radiology, you have a radiological center, okay? So basically you're consulting with that center. You don't really consult with the specific person at that particular expert center. You're talking about whoever is there will give you the opinion that you need, okay? So basically, this is one-on-one. This is basically a physician talking to a center or a group of experts. Whoever is there will be the one responsible for answering the questions or answering the requests posed by the referring physician. We're going to talk a little bit more about expert center. Expert center consultation in general as a process has three modes of telemedicine. Modes means that ways of delivering the telemedicine service. The first one is telediagnosis, meaning that the examination is done at the referring physician site. Then the data of this examination are transmitted to an expert center for diagnosis. We're talking about here basically the patient basically, for example, went to a hospital and did some lab tests and went home. And the lab tests are sent to the expert center, and basically they are going to be responsible for diagnosing basically the outcome of this examination. Okay, so the urgency of this service is nominal, meaning that it's not urgent. Basically, based on that, the turnaround is the usual turnaround, which is basically depending on the time of this consultation. It can be from few hours to 1 day, just like the usual thing that you would expect from a hospital. Basically, if you do a certain examination, for example, a radiological examination, you expect the results to be ready within a day, for example. Okay. Basically, it depends on a lot of things. Depends on who is available, or who is going to read that particular study, things of that sort. So basically, it ranges from few hours to 1 day. So there is no urgency there. Okay, this is the usual telediagnosis mode. On the other hand, you talk about teleconsultation. Basically, sometimes the patient has to do a certain examination in order for the treatment to be determined, or basically the further action regarding this patient to be determined. For example, the referring physician wants to check, for example, the blood pressure, okay? And based on the blood pressure, he would actually recommend further testing or further examinations, for example, okay? So basically, the patient would be basically he goes to the hospital and does this examination and waits. He has to wait until the outcome of this examination is looked into by the doctor, and then he decides what to do with that patient. For example, he might admit the patient. He might say that the patient has to be admitted to the hospital, or he might say that the patient is fine, he can go home and probably come tomorrow and do some further testing. So basically here, the patient has to wait. So in the teleconsultation mode here, the patient may be still waiting at site while the referring doctor requests second opinion or diagnosis from an expert center. Okay, so in this case, the turnaround time, the time from the request to response, including the diagnosis or the second opinion requested, it can be very short. Actually, we're talking about maybe half an hour. Okay, very quick. Okay, 1 hour maximum. Okay, because basically the patient is waiting. So basically you cannot delay it further than that. So this is a little bit more urgent. So this is a teleconsultation mode. The doctor consults with an expert center or an expert in the field of the particular disease of the patient, basically, or the particular pathology of the patient, basically, and waits for that opinion in order for him to make the decision about what this patient should do. So this is the second mode. The third mode is a little bit further involved. Here you're talking about basically you're involving the expert during the examination itself. So basically here we're talking about the patient did the examination and is still waiting in the hospital to determine what to do next. Here the patient is basically inside the examination room. And basically the expert might suggest things to do in the examination room. So the expert here is involved in the examination itself. So it's a little bit more further involved. And basically we're talking about real-time mode here. So basically the expert is involved in the examination itself in real time. Okay, so here we're talking about telemanagement. Patient may be still in the examination room at the remote site, and the expert is required to provide immediate management care to the patient. So basically he directs the people who are with the patient to do exactly what he needs in the examination. Basically, if he's doing a certain radiological examination, he would say, please look at this and send me the images. Please look at that and send the images, things of that sort. Or try this particular sequence for MRI, for example, okay? So basically, he's involved in the examination in this case. So here, we're talking about, we're not talking about sending a request and waiting for the answer. Here, the expert is involved in the examination itself. So the first one, telediagnosis, the patient did the examination and went home. And the diagnosis is requested from the expert center. For the teleconsultation, basically the patient did the examination and he's waiting outside, waiting in the waiting area in the hospital. And basically the expert center will guide the referring physician to what he should do next. For the telemanagement, the patient, while doing the examination, the referring doctor is actually consulting with the expert center. So basically, for the telemanagement, you're basically directing what goes on to the patient in real time. Here, there is no urgency. So basically, you're talking about hours or even a day. Here, it's a little bit more urgent. You're talking about half an hour. Here, you're talking about real time, basically consultation with the expert center. Please, if you have any questions, just ask at any time, okay? So what we're going to discuss, in order for us to be a little bit more specific, we're going to consider the teleradiology, which is basically one of the telemedicine application. Basically, it's probably the most dominant or the most commonly used telemedicine application. Okay, and also, as we're going to see, this is probably the most challenging because it involves images, transfer of images, and basically whenever you're transferring images, you know that the image sizes are really huge. So basically, this is the most demanding application of telemedicine. Any other telemedicine application would be much simpler, okay? So the teleradiology is a subset of telemedicine, basically. And it deals with transmission, display, and diagnosis from images and other patient-related information, just like what we saw in PACS. When we talk about, I'm going to actually contrast the teleradiology with PACS, but usually the main thing here, just consider for the teleradiology, you need the same information that basically the reading doctor in PACS would need. Basically, you need the images. Sometimes you need the images from the history of the patient, from the EHR of the patient. You need the clinical information of the patient, like past history or basically the patient medical record, so that you basically the doctor can diagnose the images properly. So you need a lot of information. But the most problematic part of the information is the images because they are really huge in size. Okay? So basically, in this case, you deal all this information. Basically, you need basically to have the images and the patient-related information, and basically you send it to basically between the remote referring site and the expert center. Okay. For this case, the technology requirements for teleradiology are much more stringent than general telemedicine because it involves images. So when you're trying to transfer, for example, medical records like lab results, for example, it's basically text file. Basically, all the lab results can be put in a text file, and it's usually very small in size. But when you're talking about images, you're not talking about a single image. You're talking about studies that include volumes and very high resolution images. And these are really large in size. And whenever you're thinking about transferring such images over the internet, for example, you can actually realize that it might take time to do that. If you're talking about the applications that don't involve images, like the general telemedicine, like for example, we saw during the pandemic, actually, the Medical Services Center at King Abdulaziz University allowed virtual doctor visits, okay? So basically, you're communicating with the doctor over a certain telemedicine technology, and basically you're doing whatever you're doing during your visit over that virtual link, basically. So basically, we talk about the telemedicine without teleradiology requires only very simple technology, because basically the information, the amount of information that you need to transfer to the expert center is much less, okay? So all you need to do is to gather and arrange all the necessary patient information, examination results, and diagnostic reports, and basically collect it on the referring site computer, and then transmit such information through a certain modality of telecommunication, usually the internet. Maybe 20, 30 years ago, you would transfer such information over phone lines using very old technologies, but now most people actually use internet. Even the phones are now working using the internet. So basically, the main telecommunication technology that is used now is the internet, and you send it to a second computer at the expert center, where the information is displayed as a soft copy on a monitor, and basically the doctor can make the diagnosis out of it. So basically, if you can imagine the flow diagram of what happens in teleradiology, you have the patient record, okay, including the medical images that you got, basically. The clinical results, basically, if you have lab results, if you have any ECGs, things of that sort, you have them here. Sometimes you have chemistry, sometimes you have, actually chemistry should be the lab results. Sometimes you have the outcome of a physical examination. If you have any medicines that the patient is taking, or the history of medication that the patient was using, basically you can get it from here, and you gather all this information and use a software to basically select or allow the doctor to select whatever he needs out of these, and basically send it through a telecommunication protocol to the expert center. Once it is received there, you have a display software that allows you to get such information displayed properly for the doctor. you're talking about if you have a lab result, you display it as a text file. If you basically, it's just like the EHR software that we did the project one on, basically. If you have images, sometimes if you have Teleradiology application in particular, you need to be able to display a soft copy of the images. And usually you need to have something like a display workstation or something like the PACS workstation that we talked about in PACS. There are several issues in telemedicine in general, and they are definitely present also in teleradiology as a part of telemedicine. The first one is related to privacy. Privacy is extremely important because basically what you're doing is you're sending everything over a public network, basically. The internet is a public network. And if you send the information in plain text or basic without encryption, you have a problem because basically people can intercept it and basically you can read whatever its content can, may be, okay, which is a very big problem regarding patient data, okay? So basically privacy is considered very seriously during the delivery of telemedicine service, okay? So you need to do data encryption, and you need to do some authentication basically in the service so that you can work properly on this. The encryption means that whatever you're sending cannot be read except by the person who has the key, okay? So basically if somebody intercepts, if you have a man in the middle attack or something like that, he will not be able to make anything out of the data because it's encrypted and he doesn't have the key. On the other hand, authentication, we're going to talk about it a little bit more further along this lecture. Authentication means that you know exactly where this data is coming from, okay? You can basically, if you receive a certain study, you can actually authenticate this study to be coming from this center, okay? So basically, nobody can basically, nobody can replace these images or basically switch images or do any problem or basically do any alteration to the images that you received. So authentication means that you can know exactly where the source of images are. The source of images is basically verified when you have authentication. So these two are very important. If you have these two, basically the privacy is guaranteed. Okay, basically because encryption hides the data, authentication means that the only the person who can or should read the data is able to do that. Anybody else cannot do that. And you know exactly where the data is coming from. The second issue is about the hardware and telecommunication choices. It means that basically if I wanted to send for example, if I have all the patient data is like 1 megabytes, for example, it's different from when I have 1 gigabyte. If I wanted to transfer this is very easy. You can use very modest internet connection, and basically you're talking about hardware and talk about the telecommunication options from the internet service provider. Basically, any modest options in these would be just fine. If you want to transfer 1 gigabyte, then you might really want to consider which kind of hardware and which kind of internet service that you would like to have in order for this to be transferred in a reasonable time. Okay, so basically the hardware, the choice of hardware, which is for example, the modem that you're using or the router that you're using, and the telecommunication choice, which is basically the internet service plan that you have, vary according to the required data throughput. Throughput means that whether you're just going to send 1 gigabyte per day or 1 gigabyte per minute, for example. Okay, so the throughput means that you know how much information has to go through this link. Okay, if you do this only once a day and just 1 case per day, then you don't really have to worry about it. Okay, if you're going to work with telediagnosis, where the response can be hours, you know, you allow hours for the response, then it's not a big deal actually to transfer 1 gigabyte over half an hour, for example. Okay, but if you're talking about Telemanagement, for example, Telemanagement, you need to have real-time response. So basically, the doctor in the expert center has to be able to see the images that result from a study, in the examination room in real time, almost in real time. So basically, you're talking about a very much different telecommunication choices. The third issue is about the software components, which means that, for example, if you're going to display the images at the expert center, we talked about PACS and we talked about the display workstations or the reading workstations, and we mentioned a lot of functions that must be there in the reading stations. These are really very sophisticated functions, and usually the softwares that are used there are very professional. They are usually very expensive. So basically, if you have a hospital like this and you have a PACS system, for example, and you would like to send a study to be read by an expert center, do you expect the expert center to have that very expensive software available there? Sometimes it's not. If you're talking about, even if in particular, if you're talking about a specialist, if you're not communicating with an expert center, you're just talking to a specialist in a particular radiological area, for example, okay? Then you don't really expect a single doctor or an individual doctor to have a very expensive software at home. So basically, the software component is very important because it includes the information display with good graphical user interface and some quality assurance and communication protocol programs. So basically, it's a software that would allow the doctor to retrieve the images over the link with the referring site and be able to display it properly with a good graphical user interface that allows some processing that we saw before, like the image manipulation functions or image transformation functions that we talked about, or even the image, the advanced imaging functions like we have 3D visualization and things of that sort. Sometimes this software component can be a basic software that has the main functionalities but doesn't have all the functionalities. So basically it can be provided by the referring site, or as we're going to see, we can actually use web client servers. This is the other thing that we're going to talk about. We're going to see the difference between these two options. But the software programs can be supported by either the hospital information system department or outsourced from vendors. But actually, it has to be it has to be basically agreed upon between the referring site and the expert center or the referring or the consulting specialist. If you have a web client server, basically it works like the hospital, the referring site would act like a web server, and basically the specialist would act like a client. And in this case, you can actually have your software available through that client server model. So you can allow your web server to basically connect securely to the expert center and would have a part of, at least a good part of the functionalities that you have in your PACS reading workstations available through that web client server. Okay, and basically because of the simplicity of that model, it became very popular. Okay, in this case, if you have a web server like this, sometimes the internet service provider actually can support both the hardware and software services that you need. Meaning that if you have a hospital that doesn't even have a PACS, sometimes the internet service provider can actually provide you with a solution that allows you to basically share the images with the web server. Basically, you can host the web server on the internet service provider services, and basically allow it to be accessible from both the referring site and the consultant. And also you can actually upload a certain software that you prefer, the reading software. It can be also uploaded there so that it can be accessible by both sites. Okay, but this is one of the options that are very important, and it became very popular because basically it's the simplest one. It's basically the least demanding as far as the hardware that you need to have. If you could talk about the expert center models, as we talk about a little bit more here. Basically, it secures images for the radiologist to read so that no images will be accidentally lost in transit. This is very important. This is actually kind of, we talk about in transit, we talk about a little bit of a historical or a legacy part of this area. Basically, when images would be taken, like hard copy images, like films, would be taken in a hospital and basically sent via express mail or something like that to an expert center, and the expert center would read that film and basically reply back with a report. Okay, we're not talking about the digital age here. We're talking about the pre-digital age. Okay, the before digital age. Okay, so sometimes the images would get lost actually in the transit between the referring site and the doctor at the expert center, and this would be a problem. So basically, we talk about teleradiology because we use information technology. We have everything in the digital domain. So basically, we have no problem with losing the data in transit. It also reduces reading cycle time from when the image is formed to when the report is completed. We're going to talk about this in a little bit more details, because basically sometimes you think that basically the expert center is just like the doctors in the hospital. They have certain working hours from like 8 to 5, something like that, and basically they are not available afterwards. But actually, as we're going to see, there are some models in expert centers that would be hosted in different countries, so that you can make use of the difference in time zones. So basically, if you have a case after hours, you can send it to an expert center in a place where this is their working hours. So basically, you can get the report back in much shorter time than the regular working hours that you have at your hospital, for example. So basically, this is one advantage you can take care of. Okay, reducing the reading cycle time. Okay, so basically you get the report much faster when you use an expert center model. The big use of telemedicine actually is very clear in radiology in particular, because radiology is subdivided into many subspecialties. Basically, if you consider that a doctor who specializes in ultrasound imaging, for example, he's not going to be able to read MRI or CT. Okay, he can actually, there are some general radiologists, but actually it's very difficult when you're talking about a very specific application. It's very difficult to have a doctor that knows all the imaging modalities. Okay, so basically you have many subspecialties in radiology in particular. So basically, there might be a general radiologist present at the hospital, but actually, because his background is general, he's not specialized in a particular or all the imaging modalities. So he might occasionally require some expert second opinion. So, for example, if he's not, if he knows MRI in general, but he has a very specific case that has, if you have a very difficult case in MRI, for example, okay, he's not sure about his decision. He needs a second opinion. So basically, he can actually use that expert center to confirm his diagnosis, okay? And this second opinion is provided by teleradiology. So this is very clear in radiology, because you have so many different modalities, and even within each modality, you have so many different applications. So it's very difficult for a general radiologist to know all of these subspecialties. So having an expert center model through teleradiology would facilitate having a second opinion to confirm the diagnosis for the doctor. Basically, this is related to the first one here, potentially increases radiologist income because no images are temporarily lost and subsequently not read. This is kind of legacy. Basically, it's as we said before, we don't really lose images now, okay? This used to happen because basically films would be taken and basically they are sent somewhere, and basically they might be misplaced and people are looking for it. So basically they might actually think that it's lost, but it probably might show up or somebody finds it a day or two later. So basically, these kinds of problems are not really realistic now with digital images. But actually, this, if we were talking about the legacy operation of a radiological department, losing an image would actually mean that the radiologist would not read it. And usually, if you have a consultant or if you have even a radiologist, basically, his work might be actually, his reward might be actually related to the number of images he reads. So basically, if the images are lost, basically, he might actually lose a little bit of income. Okay, so basically, this is kind of an old, it's not really realistic to talk about it now, but actually, it's one of the things that people mention in this part about teleradiology. Because basically, you don't lose any images, so basically, all the images are read, so basically, the income of radiologists basically is usually the maximum they can get, because they read all the images that are available to them. In addition to all these, actually, cost effectiveness. Expert multiple sites, and it has faster turnaround. Any questions? Okay. I think somebody opened the audio, something like that, and opened the mic, and the audio came back. I heard myself, so probably. Let's talk about cost effectiveness. If you think that you have, for example, you have flow of patients in ultrasound imaging and MRI, and usually for ultrasound images, you have one of the very specialized ultrasound imaging application is echocardiography, for example. It's very difficult, or it's usually very difficult, but actually it's very different from abdominal images, for example. And it's very difficult also, very different also from obstetrics, where you basically look at pregnant women and determine the age of the baby, for example. So if you want to have an expert in each one of these applications, it's going to be really expensive to have experts in all of them, okay? And usually you don't really get patients of these kind of applications every day. So basically, what you usually have is a patient, is a doctor that specializes in the most common application of ultrasound, like, for example, abdominal images or abdominal imaging, basically. And if you have a case of echocardiography, you would send it to an expert in the expert center, okay? This would be actually much more effective, because basically the experts are localized in an expert center, and they receive information or receive cases from multiple hospitals. So the experts are busy. They are utilized properly. Their time is full, basically is fully utilized, because there are cases coming from many hospitals. At the same time, all the hospitals have the service of such experts in these very specialized cases. Okay, so this is very important. In addition to that, basically it's cost effective because also the management of the patient actually is much faster. So basically, if you have, for example, even if you have an expert at the hospital, usually don't hire the expert full time. So sometimes the expert might come like a day a week or something like that. So if you're going to wait for the expert, for the local expert in the hospital to come, maybe it can be a few days actually until he comes. So the patient would actually have to wait until the expert comes and basically diagnoses his case and basically determines what's going to happen next. If you send it through teleradiology to an expert center, you can actually get the diagnosis, as we said before, a few hours to a day maximum. So this is much more effective, and basically the faster turnaround will be actually much more cost effective, because basically you're not waiting on this patient. You can actually determine the next step for this patient and start right away on it, okay? And at the same time, as we said, there is no loss of images. Basically, you don't lose images when you're using teleradiology. So the flow diagram, basically, if you talk about teleradiology in particular, you have a certain primary care physician or patient from rural clinics. You're talking about usually kind of smaller hospitals, okay? If you have a smaller hospital, if you have a large hospital like a university hospital or something like that, you usually have enough experts to do your cases usually, okay? Or if you have a specialized hospital, then people come to you in a very specialized application, so you usually have the proper experts that you need in your very specific application. But you're talking about a small hospital like rural clinics, like clinics in the villages, or if you have community hospitals, if you have a physician, basic general care physicians, something like that, just a clinic for a single doctor, something like that, and this doctor has an ultrasound machine, for example, that he can use. Basically, these are the kinds of people who would really take advantage of having a teleradiology service. So basically, for these kinds of healthcare facilities, they might do radiological examinations, and basically the images and the information associated with it, like the patient information, are transmitted to the expert center, and the expert center makes the diagnosis. This cycle actually from basically entering the hospital to receiving diagnosis might be from a few hours to 1 day, as we said before. This is for the telediagnosis part. If you're talking about a teleconsultation, then what you need to have actually is something a little bit faster. So basically, between the radiological examination and the reception of the results, basically this would take like a half an hour. So this is the teleconsultation. Okay, between this, basically goes through this cycle here, and basically the diagnosis would come back here around 1/2 hour later, something like that. If anything, basically for the teleconsultation, it might actually suggest that a different radiological examination be conducted. So basically, this might be actually, might go a little bit like a couple of times, for example, until you actually reach a diagnosis. But actually, in this case, you have a much faster turnaround. The even faster turnaround would come in the telemanagement, where you're actually involved in the actual radiological examination. You're not doing the radiological examination and dismissing the patient. No, the patient is actually either in the clinic itself, you know, before you decide what to do about the radiology, which modality basically is going to be used. This is actually determined by the expert center. And you're talking about, for the telemanagement, talk about almost real time. So here you decide what's going to happen to the patient. You're not inside a particular radiological examination, or basically you didn't do the radiological examination yet. You determine what exactly you need to do. And basically you start doing that, and the expert center is, you know, basically consulting with you in real time, is helping the doctor, the referring doctor, to manage the case in real time. So basically you have a slow cycle for the telediagnosis, a little bit faster for the teleconsultation, and eventually real time for the telemanagement. If you're going to compare the teleradiology versus PACS, which are really, the two are very similar actually. But actually you have to think about PACS as a system that is installed in a particular hospital. Okay, so basically this is, you have the archive server, you have the modalities, you have the reading stations, you have the quality control stations, you have the doctor stations, the physician stations, you have all these things, they are inside the hospital, okay? While teleradiology, you're actually connected to somebody outside the hospital. So basically this is the main difference actually, okay? So, but as far as the service that they both do, they are very similar. So basically, when the teleradiology service requires the patient's historical images as well as related information, this is exactly what PACS does, okay? So as far as the service they both do, they are very similar in this case, okay? So basically, the doctors, either in the reading station, on the reading station of PACS, or at the expert center, they are doing exactly the same job, okay? But the biggest difference actually is here. Basically, the image capture method that some current teleradiology operations still use actually is basically they use digitizers, basically. We're talking about teleradiology as a tool that you would use in a little bit older hospitals, or basically hospitals that don't have that much or that many resources, basically. So sometimes they have films. They are still using films. If they are working with ultrasound machines, they usually have ultrasound machines that are not connected to the network, for example. So you get the images in hard copy form and use a digitizer that we talked about in PACS and convert these images to digital form and send them to the teleradiology service. Okay, so basically for the teleradiology, for most smaller hospitals, which actually constitute the majority of places where teleradiology is used, the primary method is using digitization, and you convert the images to digital format, and basically the opposite in the PACS. Basically, if you have a PACS installed in a hospital, usually most of your modalities are digital. So basically, you have all the images, readily in a digital form, and you connect them to the archive server using the network. And you don't really need to have a digitizer, except if you have, except when you have a patient coming from outside. So basically, there is a big difference between the two in the image capture method, the way you get the images that you use to send to the Teleradiology Expert Center. Okay. Another difference is that because PACS is inside the hospital, you're using a local area network, basically. Okay. If usually teleradiology, you're talking about an entity that is outside, and usually it might actually be in a different country in some cases. So basically, you need to have internet. So basically, they call the internet wide area networks. The speeds of wide area networks are much slower compared to the speeds of local area networks. Okay, so local area networks, you can very easily get a gigabit Ethernet at home. Okay, it's very simple. Actually, most of the newer network cards actually support that speed, but actually it's very difficult to get that speed in the in the internet. Okay, you can have like 100 megabytes, 100 megabits per second, or 200 or 300, but it's very difficult to get a gigabit or multiple gigabits per second internet. So basically, it's slower. You're using slower speed connection, network connection, because you have to have use the internet. While when you're working with PACS, you're using the local area network, so it's much faster actually. This will affect actually the way that we're going to have, basically you need to have image compression for radiology, teleradiology. Image compression means that you need to get the images and reduce their size. We're going to talk about this also at the end of this lecture, how we're going to do that. So basically, if you use compression, what you need to do is basically reduce the size while not compromising the quality. And this is very important for teleradiology. While in PACS, you may or may not use that. You may use it in order for you to optimize your storage capacity, but actually you don't have to do that. Okay, many PACS systems don't really have to do that. Okay, but for teleradiology, it's a must. So basically, these are related to each other. These two. For teleradiology also, image storage is mostly short-term. We talked about the archive server. I talked about actually the storage options that we have in PACS, and we said that there are things that we use as short-term storages, like the ones in the reading workstations, and we have long-term storage like the archive server, and basically if you need to basically store them for many years, actually you can do that. But for the teleradiology, basically the expert center might need to have sufficient storage for a week, and that's it. Okay, because basically you're getting a copy of the images from the referring site, and once you finish the case, you don't need the data anymore. You don't have to store them. Okay, so basically you can delete them. So basically the image storage used in teleradiology is usually short-term, which can be basically just simple hard drives or RAID drives, as we said before. For the PACS, it's long-term, and we actually talked about the options for PACS for long-term storage in PACS. And here, of course, the image compression is definitely present in teleradiology much more than PACS. It's a must for teleradiology, it's an option for PACS. So basically, if you want to compare them in a table, just list or summarize these items in a table. For the image capture, for the teleradiology, you might get the data from a digitizer, which is actually very common, or DICOM. Usually for PACS, everything is in a DICOM format. So basically, it's a digital format from the beginning. The display technology, definitely you need similar monitors because you need to have the same quality of display that you can, or basically that allows the doctor, either in the expert center or inside the hospital, to be able to read the images properly. So basically, the display technologies are very similar. So the kind of monitors, the medical grade monitors that we talked about, and was part of your project in this area, basically it applies to both of them. From the networking, you connect the referring site and the expert center using wide area network, which is basically the internet, usually. Here you use LAN usually because it's inside the hospital. You're connecting all the components of PACS basically within the local area network. The storage for teleradiology is usually it's hard disk. Usually it's either a hard disk, just a simple hard disk, or a little bit rarely RAID drives, or which is collection of the similar hard disks that we talked about before, which is intended for short term. For PACS, we use several technologies actually that we discussed in the PACS lecture, and basically this is intended for long-term storage. Compression is a must here. It's very important to have compression for teleradiology to be able to transfer the images in a realistic time. For PACS, it's just a matter of optimizing the amount of storage that you need. So basically, for the part where you read the images, you usually don't compress them before you read them. So basically, it can be, or it's actually less likely to be used here in PACS. So if you talk about the teleradiology components, you have an image acquisition device, which basically can come from direct digital, can come directly from the modality in a digital format, or you can have a digitizer, like the ones that we talked about before. So basically, you acquire the images in a different way here. Once you get the images here, you do data reformatting. Sometimes you can actually sometimes, for example, the images here might need a little bit of modifications or a little bit of adjustment. For example, you just include the images in a particular size, for example, or basically sometimes you pre-process them somehow in order for them to be ready for reading. Okay, so basically you reformat the image data this way. Usually you include some information from the HIS or RIS, like the patient-related information. You grab them from the patient EHR and basically include them together in a format like the DICOM or whatever. We're going to talk about it in one of the standards that we're going to discuss later in this course. And basically, you have the images here that include the image data and the patient information together. Okay. The next step is to do image transmission, which means that you have to connect somehow. You have to take the data that you prepared and basically connect to a particular telecommunication channel, which is usually the internet, and basically transfer to the expert center. You have to have storage to be able to store the data on the expert center. You have to have a display to be able to display the images. It's very much like the reading stations that we saw in PACS. And basically after that, you do the reporting. This is actually the reading or the results of reading of such images is the reporting. And basically the reporting basically is sent back through the same channel, or sometimes it can be sent actually by fax or whatever. It depends on the kind of agreement that these two, the referring site and the radiology expert center, are having in between them. And at the end, you have billing. Okay, billing means that basically there is a contract between the referring site and the radiology expert center. This contract actually might be per case, or might be per month. It depends actually on the kind of agreement that you have. And basically, whenever this cycle happens, basically the billing must actually account for all the cases, and basically so that basically the cost of reading basically is properly addressed between the two entities. Basically, if you talk about if you're going to have an expert center, basically you have to have high-end 1K or 2K workstation. Basically, this is a resolution that you need to have. This is the HD, and this is the ultra high definition. Basically, it's like a little bit more. And basically, usually you have to have 2 LCD monitors. Usually in the expert center, you have to have that. Usually, you should plan for a hard drive that would allow for 1 to 2 week local storage for current and previous exams. So basically, you should have sufficient storage that allows you to have cases that you had in the past 2 weeks. Why in the past 2 weeks? Because sometimes you need to follow up on a case. For example, the case was submitted to the radiology expert center, and they read the images and they sent the report, and basically this report was read a few days later by the referring physician, and he had a question. Basically, whenever he has a question, he should be able to contact the radiology expert center with his questions. The radiology expert center doesn't need to have the images sent again, and basically whenever that happens, maybe the doctor will have to read it again, or we have to basically adjust the way he was reading these images again. Basically, if you have certain settings, transformations or manipulations, in order for him to be able to properly read the images, he needs to do that all over again. But if he still has the images, he might actually store them with whatever manipulations he did, so that whenever a question comes regarding these cases, he will be able to answer them without having to go and start from scratch. Usually, you need to have a very fast computer so that you can actually have 1 to 2 second display of images and reports from the local storage. So basically, you should be able to read the images quickly and display them quickly on the workstation, so that you don't have to wait for images to load. You have to follow the standards. Basically, these are the 2 most important standards in medical informatics, which is the HL7 and the DICOM format. Okay, HL7 is related to the communications between different medical informatics softwares. It creates a certain set of instructions so that you can communicate in a standardized fashion between any 2 softwares. And DICOM is the standard format for images. So basically, it's very important to have such conformance, because basically, in order to have interoperability, as we mentioned very early in this course, interoperability is very important, and it's one of the things that if you want to get certified, basically you have to have that interoperability. So basically, if you follow these standards, you maximize your interoperability with other softwares. You have to keep in mind that the expert center works with different hospitals, okay? Meaning that basically different hospitals usually use different softwares. And basically, if you want to be compatible with all of them, basically they have to be compatible, or you have to be conformant with HL7 and DICOM, and you have to be also the same way in order for both of you to be able to communicate. As with any reading workstation, you have to have simple image processing functions like the image manipulation and transformation functions that we talked about before. Sometimes you can also have the third one, which was the advanced options. It depends on the kind of expertise that are needed. Basically, you might have the advanced functions as well. And you have to have very good internet communication. Basically, you have to have a very good internet communication or internet service in order for you to be able to communicate, to receive and send whatever data you need in a timely fashion. For the teleradiology, there are several models that would justify the use of teleradiology. One of them is the off-hour reading. Off-hour reading meaning that if you have a patient that comes after 5, for example, after all the radiologists left, for example, okay? Or if you have a radiologist that took a vacation, for example, okay? So basically, in this mode, you're taking care of reviewing images during evenings, weekends, and holidays when most radiologists are not available at the examination sites. So basically, you're talking about a site that has radiologists, but they are not available at the time when you actually need them to do a reading. So basically, the reading center radiologists perform online digital reading and preliminary assessments of examinations and transmit them to the examination site instantaneously after reading images. So basically, this would help get a quick report to the referring site without having to wait for the doctor to come next day, okay? Sometimes the radiologist, if the case is not urgent, then the radiologist might actually verify the readings and sign off the report next day. Okay, after they read the report from the expert center. Okay, if the case is urgent, then the attending physician might actually, act upon them, and basically, in order for a patient to be saved from a danger or something like that. So the setup here serves the purpose of compensating for shortage of radiologists during the off hours. It's not a general shortage of radiologists. Actually, there is a general shortage of radiologists, by the way, in the world, basically. The number of radiologists is much less than what is needed. This is a general shortage. But here we're talking about the shortage of radiologists during the off hours. Okay, you have a case, and you need to diagnose this case to confirm something, or basically to make sure that you're not, you're not going to make the patient wait for a long time before he gets the diagnosis. So you actually can use the teleradiology in order for you to be able to do that. So many such of our reading centers throughout the world take advantage of time zone differences. So basically, here you're talking about, for example, people in the US basically having expert centers in Europe, for example. Okay, because for example, if you're talking about somebody in California, for example, and somebody here in the EU, in somewhere like Germany, for example, the difference between these two can be like maybe 4 + 7 plus almost 11 hours. Okay, so basically, whenever the people are off here, they are on here, and the other way around. Okay, people also in the EU can have expert centers in the US. Okay, some people actually in the EU, they can actually use some expert centers in India, for example, like what they do actually in customer service. Sometimes actually people do that also in expert centers. But actually, it depends on the availability of experts at the countries where this happens, actually. But this actually, taking advantage of the time zone differences can actually make this much more much simpler, actually, because basically you're not going to have attending physicians working 24 hours, for example, in a particular place. You actually have radiologists working the regular hours, but basically because the regular hours coincide with the off hours of another country or another place, basically they can actually do this service without any problem. So this is very important mode of teleradiology. There is another mode actually called application service provider, which means that basically in some hospitals, they don't want to have a radiology department at all. So basically they would come and basically hire what's called application service provider. This application service provider, basically sometimes the major equipment manufacturer like Philips, like GE, like Siemens, like whatever, Toshiba, they can actually install the equipment, the imaging equipment. They can install the networking equipment. They can install basically all the hardware required for teleradiology. And basically, they can actually connect them to an expert center. So basically, the whole place or the whole facility would work with teleradiology. Okay. Sometimes it can be used for just supplying the equipment, but sometimes you can actually supply both the equipment and the radiology readings. So basically, you might actually have contracts with expert centers so that they can connect the sites where they install their equipment to the expert center so that they can do both the reading and basically the reading and basically they install the equipment and do the readings for the hospital. Okay, so this is actually a very good thing basically because the hospital doesn't have to take care of the whole process. So basically, they just hire that application service provider and they take care of everything related to that particular application. Sometimes, by the way, they don't have to pay even anything. Basically, they can put the equipment and basically they can make a deal with the hospital so that they can pay per case. So basically, whenever a case comes, the hospital would take a certain amount from this case, and the rest goes to that application service provider. So basically, it can have certain very interesting models, financial models for the hospitals. So this can be actually very well suited for very small hospitals or rural hospitals or places where the financing of at radiology department might be actually challenging for them. So this is a very interesting mode of teleradiology. The common mode actually that people use is related to web-based teleradiology model. This is actually the one that I mentioned that is most popular. And basically, this is the easiest to manage actually. So basically just, instead of just, let me just imagine with you that you have a certain hospital. And basically, you want to make the easiest way to communicate between this hospital and an expert center. The easiest way is to have a web server, which is usually available in hospitals, because it usually have web sites. So basically, they have already, usually already have a web server. So what they can do is to have a part of this web server to be accessible through a password, for example, okay? So like a private part of the web server, okay? They can actually upload the data there. Once they upload the data there, it can be accessible by the doctors on the other side in the expert center, okay? So basically, this can be very easy to implement. You don't have to have specialized equipment. You don't have to have specialized protocols in order for you to be able to communicate with the expert center model, for example, to transfer data and things of that sort. So basically, this can be a very useful way of doing this, okay? So basically, you have in this web server, you have filtration of images. Filtration of images doesn't mean that you're going to change the images. Basically, you're talking about which images go to which users. Okay, so basically, if you want to send a particular case to a particular expert center, then you have to filter which images to know exactly which images must be sent to that expert center. Okay, and basically use these images and post them on your web server. Okay. So basically, you have that these filtered images actually, the way basic means that you have a web server that has a predetermined directory managing the image distribution based on certain criteria like what type of images to where and to whom. Okay. Basically talk about types of images, which kind of images that you're going to send, and basically send it to which expert center and or to which doctor, for example. If you have a specialist, it doesn't have to be an expert center. If you have a single doctor or a specialist, you can actually send it to that particular person. So basically, you have to have authorization and authentication so that you can actually direct the images to the right person. The advantage here actually is that the clients can view these filtered images from the web server using regular web browsers. Okay. So regular web browsers can actually access them just like a website, usual website. But the issue here is that the quality of images, the kind of display of images on regular web browsers is not as good. So usually you have to have a certain, basically certain applications or certain plugins in the web servers or the web browser so that you can display the images with the required quality. Okay. For example, if you want to have 12 bits, for example, then usually the images that are displayed in websites, it's usually they are usually displayed with 8 bits per pixel, for example. But basically, if you want to have a little bit higher, then you have to have some add-ins, some plugins, some additional software that would allow you to do that. Okay. So basically, the clients here can be the referring physicians who just want to take a look at the images. For example, if you have a doctor that, if you have the doctor from the same hospital who left, for example, for off hours, for example, and you would like to check the images again, he can actually log in through the web server of the hospital and basically look at the images from home, for example. Okay. So basically, this is one application, or can be radiologists that are in the expert center, for example. They can actually do the remote diagnosis for the hospital, for example. Okay, so the advantage of web-based teleradiology is that it's very convenient, it's very easy. Basically, you can set it up in the hospital, and basically, if you don't really care about the quality, if you just wanna, if you don't really worry about the image quality of display in web browsers that much, then you don't really need to do anything. Basically, just upload the images on the web server, and anybody who actually wants to look at these images can have access to them based on the security protocol that you have. You just direct them to the right place and give them the access credentials, and that's it. Okay, and definitely it's much lower cost because basically you already have a web server. So basically, you don't have any new equipment for that teleradiology to work. And basically, it's very simple, just a matter of setting up the server for these images on the already existing web server. Okay, so basically, it's very low cost and convenient because most of the technologies are readily available in the hospital. The drawback here that I mentioned is that the viewing capabilities and conditions are not as good as that in regular PACS workstations. So basically, if you have, if you want to maintain the DICOM image, of course, it's DICOM image resolution and visualization capabilities, and if you want to have the software also that would allow you to do that, then basically modifications have to be made to the web server to receive or to send the data in a different way. Okay, but this can be actually done, but it's not as basically it's a little bit. It would require a little bit of some software work in order for you to be able to do that. You have to develop your own plugins and basically that allow you to receive the images in the full resolution and display them also, and allow the user to be able to manipulate the images and transform the images the same way you expect the reading workstations to work. So this is basically, if you want to go with the least expensive, the most straightforward, the most convenient, then the web-based teleradiology model would be the best. Sometimes you have just teleradiology. So basically, you have a hospital that works in this model here. You have imaging modalities here that would be basically would deal with the Teleradiology Management Center that would basically connect the hospital to the expert center. You might have more than expert center, by the way. Sometimes you have an expert center per modality. So if you have a certain modality, it would go here. If you have another, it will go there. Okay. So here you don't have any reading workstation inside the hospital at all. So just connecting the modalities, you're just getting the data from the imaging modalities to the Teleradiology Management Center, and this basically has all the components that we talked about. It has the way of communicating with the expert center. It has the way of basically manipulating or basically receiving the response and adding the response to the patient records and things of that sort. Okay, so basically it receives the data and basically it's image data or the patient data and receives the report, sends the reports back to the imaging center. Okay, sometimes you can actually have If you have multiple sites inside the hospital, then you can connect them all to a certain single teleradiology management center. And basically, for each one of these, you can actually have multiple expert centers actually working to basically diagnose the images that you receive from here. If you have PACS, you can actually combine PACS with basically teleradiology, because as I said before, it's very expensive to have experts in all kinds of applications in radiology. You have so many subspecialties in radiology, and basically even within the same. For example, as I said before, ultrasound, you have a different doctor who reads echocardiography, from that who reads abdominal images, who's different from whoever works with breast imaging and musculoskeletal imaging and vascular imaging. Basically, there are different people usually. If you want to have an expert, if you have a difficult case, basically you want to have an expert that is basically specialized in the specific case that you have. Okay, so basically you have an advantage of having a PACS, basically because most of the cases, like 90% or 95% of the cases, would be diagnosed by the local radiologist. But some of the cases can take advantage of having a second opinion from an expert center. So basically, in this case, this is basically the flow in usual PACS system, basically. You have a connection to the HIS-RIS database. You can have imaging modalities. You have the imaging modalities would write to the archive server, and basically you have application servers where you have the reading stations here. Maybe the workstations can be here, or the application servers can be here also, in order to allow basically certain studies to go to certain places. So basically, you can add from here. You can actually get the data from the HRS and RIS. You can get the data from the archive server and send them to the expert center through Teleradiology and receive the report after you finish. Okay, so basically you can have Teleradiology interface to PACS, and they can both work together inside the hospital. Okay, the model for this is, you can imagine that the Teleradiology as a part of the PACS, but this part is a little bit remote. It's not is offsite. It's in another place. Okay, but you're actually connecting this, the Teleradiology center to your network here, so that they can access the PACS server. Usually, if you have a connection of this kind, then you probably want to have something like a VPN, something like that. You have to have a secure network that would allow you to basically access the data here in a secure manner. Maybe you can actually have a part of the PACS archive here in a demilitarized zone that we talked about last lecture. And basically, in the demilitarized zone, it can be accessed by the Teleradiology Expert Center, and basically they can actually read the images and put the reports in the demilitarized zone in an encrypted and authenticated manner, and basically can be added to basically the PACS workflow after that. So basically, in principle, you can actually combine them. This is actually the ideal situation, where you have a big hospital, you have a lot of radiologists, but actually, no matter how many radiologists you have, sometimes you need an expert in a very specialized manner. If you have a difficult case, it might be actually a good idea to get a second opinion on that very, very difficult case. Okay, so basically, it's a good idea to have both working together in order for the healthcare delivery to the patient to be optimized. One very important aspect of Teleradiology, as we mentioned, is that you have to have image compression. Image compression is very important because usually the speed of transmission actually is very slow. It's much slower than the local area network. Okay, so basically, if you want to transmit a large amount of data for a case, for example, and basically this is the case for MRI and CT and things of that sort. Usually all the data sets are 3D and usually have multiple studies. So basically, usually the data is huge for each patient. So basically, it's very critical to have, basically to optimize the way you're going to transfer the images to the expert center. Okay. Usually image compression has two modes. You have either lossless compression or lossy compression. For the lossless compression, basically it's a one-to-one correspondence transformation, meaning that if I go from the image, if I do the compression, this is the compressed image, okay? Basically, it's one-to-one, meaning that you can go back and forth without any loss, okay? If I get the image here, I can go get a compressed version of it, okay? If I have the compressed version, I can go back and get exactly the same image that I started with, okay? In this case, the maximum compression ratio would be 3:1, for example, or 2:1. Okay, meaning that you probably reduce the size of the images to 1/3 of the original. Okay, which is okay. It's much better. If you have 1 gigabyte, it's definitely much better to have 300 megabytes instead of 1 gigabyte. But actually, it's not enough. Okay, so usually people try lossy compression. Lossy compression uses, probably we shouldn't really talk about these because these are kind of involved a little bit, but actually let's just mention them. And basically in the project for this part, I'm going to ask you to just research a little bit about them. So basically you have a transformation like a cosine transformation. Cosine transformation is, by the way, is very similar to the Fourier transformation. But what you need to do for the cosine transformation is to have an image that is symmetrical. And there are ways of doing that. Or you can use what's called the wavelet transformation. And whenever you do that, you get like JPEG or MPEG formats. And basically, if you have a movie, for example, sometimes you have a movie outcome from a certain imaging modality. And basically, you can compress it using MP4, for example. And this is actually one of the lossy compression techniques. And usually, you can do that using software. But actually, there are, in some cases, for example, for the MPEG and JPEG, you can actually have hardware compression. So there are chips, there are hardware boards that would actually do that for you without having to run that on a computer. So this is much faster, usually. Okay? But the compression ratios for lossy compression, you can reach something like 20:1, or at least 10:1. Okay, so basically, and we talk about here the ones that you can get with acceptable image quality. So basically, for the lossy compression, if you have an image and got the compressed version, if you want to go back, you're gonna get an image with some distortion. You're gonna basically lose a little bit of details here. When we talk about acceptable image quality, there are certain measures that are actually introduced by doctors, so that basically make sure that the images don't have visible artifacts or visible problems, so that they can actually make the same diagnosis from the compressed images. So basically, if you want to go with acceptable image quality, of course, if you don't care about the quality, you can actually get much higher ratios. Okay, but actually, if you want to get acceptable quality, then you can get much higher quality, much higher than the lossless compression, but actually it's probably gonna be limited to 20:1, something like that. Okay, the use of transformations, actually, just to give you an idea why you use transformations, if you have an image that looks like this, for example, it looks like this, if you take a Fourier transformation, it would look like this. Okay, like a sinc function. Okay, the difference between these two is that basically here you have a certain area that has significant coefficients. Here you have much smaller values. So basically, if you actually ignore these and just use this part only, you can get basically a smaller representation of the same image. If you use Fourier transformation, for example, Fourier transformation is not as good. The cosine transformation and the wavelet transformation are much better, basically. They convert the images into a format that has very few coefficients that are non-zero, and very large amount, or the maximum, or basically the major part of the transformed domain is basically either 0 or very close to 0. So if you ignore the very small coefficients, you can get a much higher compression than the lossless compression. Okay, so basically it depends on the transformation, because the transformation is kind of it does something called energy compacting, meaning that if you have an image that looks like this, for example, it would compact it to something that would have energy centered here while there is nothing here. So basically, if you just took this part and ignored, or basically imagine, or basically approximated all the other values here to zero, then you can get something that looks very close to this image at a much higher compression ratio. Okay, so basically the kind of transformation you're going to use is basically going to determine the kind of compression that you're going to use, or the kind of compression ratio that you're going to be able to do, in other words. Okay, so basically a lot of work is being done in developing transformations to compress images, developing hardware that would allow you to do such compression very quickly, because basically you have a very large data set. Imagine that you have a 1 gigabyte data set and you want to run a program on it. Okay, usually this takes a lot of time. So in addition to the time of transmission, basically you don't want to reduce the time of transmission and increase the time of processing. Okay, so usually you need to have fast processing in order for you to not add additional time to the transmission time. Okay. Some web servers actually would allow you to use something called progressive wavelet image compression technique, meaning that basically when you're transmitting the images, it would first display something that looks very crude like this. And as time progresses, as more data comes in, it would basically start increasing the resolution until you get the full resolution. So you get something that looks like the general shape of the image, and then the quality of the image keeps improving until you get the highest quality image at the end. Sometimes it's useful to have it like this, because sometimes you just want to get the general overview of the image, and then you can wait until basically until you see which part that you're interested in, and basically focus on that part. And by the time you do that, usually the data is already transmitted, and basically you have the full data that allows you to see the image. Okay. Another approach, instead of the progressive display approach, you can actually use another approach where you can construct a very small region of interest. So for example, if I'm interested in this region, I can actually send this region alone. Okay, so basically I can instruct the transmission software to start with this part, so that I can basically diagnose it, and then basically continue with the remaining parts of the image, or the volume that I have. So image compression is really important. I think probably we probably had almost an hour and a half. I think this should be enough for today. I think it's the first lecture in Ramadan, and it's actually a very difficult time for me. Actually, it's I'm usually asleep like 2-3 hours ago. Okay, so basically, I think it's better to just start with a modest amount in the first lecture in Ramadan, and inshallah next time we're going to finish the remaining part of the Teleradiology lecture and start talking about the hospital information system. After we finish the hospital information system, we're going to have a lecture about standards, where we actually are going to give an overview about HL7 and DICOM formats, or DICOM standards. And after that, the last part will be related to general overview of artificial intelligence technologies that is intended for you to just get basically an overview of what AI can do and can do. Okay, just an overview of that. I expect, inshallah, in Ramadan that we're going to finish all the topics except artificial intelligence, and probably going to have another week at least after Ramadan, and I expect this week to be sufficient to finish the part about artificial intelligence. We're going to have only one project left. That would be about teleradiology. It's going to be basically a research topic. Basically, I'm going to ask you to just collect some information about some of the aspects of teleradiology. And this will be the last project. I hope you can finish all your projects by the end of Ramadan. By just take advantage of the holiday at the end of Ramadan and Eid holiday, so that you can finish these before you can get to the last part of the course where you have the the exam. I think you can have your exam probably by the end of May. So basically, I think it's better to make sure that your projects are all submitted by the beginning of May, by the first week of May, inshallah. You have any questions? Okay, so inshallah, next week we're going to meet at the same time. Okay, of course it's kind of very late, but I think this is what you agreed upon, and I'm fine with it, inshallah. Okay, any questions? Okay, so I'll see you inshallah next Tuesday. Inshallah. Assalamu alaikum.
Alaikum salam. Thank you, Doctor.